Hello, this is Dr. Lewerenz at Longevity Health Institute. Good evening, and talked to a few patients today that brought up a slight concern, maybe a little bit of an alarm based on my newsletter. So we quarterly produce a newsletter here at Longevity Health Institute. You can actually find this on our Facebook. You can find it on our website, longevityhealthinstituteinc.com. And I wrote an article here that's called Drug Muggers, and it's based on research and science. It alarmed a lot of people, so I want to explain briefly and then I talk about another topic that'll help you. But drug muggers are drugs that actually, medications that you take that actually can inhibit absorption, block nutrients, and even affect other medications. And so they're very important for you and your practitioner. And here at Longevity Health Institute, myself, with my practitioners, we really focus on is you don't want to be taking something, one, if it's unnecessary, two, that if it's potentially has some interference with nutrient absorption, and then what nutrient that is, because they can wreak havoc on your body, and literally it's like mugging and robbing you of the benefits of some of the good quality things you eat, drink, supplement, etc. So common ones are things that affect your gut. Okay, common ones are gut medications. So those are your antacids, your PPIs, your Tums, your calcium, your buffers for your stomach. Okay, if you need them, obviously you might need them. You might need them short term. They're designed for short term, but you also want to make sure that you're treated appropriately and that is fixed so that you do absorb your other nutrients. Common medications, nutrients that are blocked by taking PPIs, Prilosec, Omeprazole, Prevacid, Nexium, Tagamet, antacids, etc., cause selenium deficiency, vitamin D deficiency, iodine deficiency, vitamin E deficiency, vitamin K deficiency, your fat solubles especially, B12 deficiency, and these have so many benefits to even your organs in your body, okay? And your organs in your body actually need these nutrients and supplements to function at an optimal and a high level. So just be aware of drug muggers. Other ones are statins, blood pressure pills, occasionally some of the anti-anxiety, antipsychotic, antidepressants. But the digestive medications are the ones you really want to watch out for. And ultimately what you want to do is what we do here. Take a personal approach, take a functional approach, get to the root cause and fix your gut, which is going to take some work. It's going to take some diligence on your part in changing your diet, and eating optimally, and eating a lot of vegetables, a lot of fruits, a lot of non-processed foods, whole foods, okay? So hopefully that enlightens you a bit and kind of clears up some of the questions I've got in the last few weeks regarding something I wrote about in our newsletter. But be aware of drug muggers. So listen, I want to talk about something else, and something that's very key, but something that is very reflective, and I've talked about it before, but something that you need to pay attention to. What is the largest organ in your body? The largest organ. Your skin. Your skin is actually the largest organ. So you can pay attention to your skin, and it can tell you a lot of things about your health. Okay, and some of the biggest things I can tell you is stuff related to nutrients, like I was just speaking of about the drug muggers, but about your nutrients and your gut health and what's happening at that lamina propria, at that digestive lining layer. Very key in overall health. But think of your skin, and I want you to reflect on your skin as an organ and as what that means. So when your skin looks red, when it looks pale, when you have blemishes, when you have acne, when you have rosacea, when you have psoriasis, when you get somebody earlier today, seborrheic dermatitis, when you have tinea, these are all reflections of what's going on in your body. Now this is too much to cover right now as far as how we fix all that. But the basics you can do is this. Get rid of the sugars, get rid of the processed chemicals, get rid of these things that are in boxes and cans, and eat whole food, eat raw food, eat a lot of fruits and vegetables and nuts and seeds, good quality proteins, okay, that are grass-fed, natural, whole, etc., okay, not hormonized, not antibiotic, etc., okay. That's a good start, okay. Your skin might clear up, okay. The other thing is see somebody like us, Longevity Health Institute, where we take a personalized functional approach in fixing what's going on internally with you. The biggest thing too, and I just saw this today, is that when you have a liver stress or you have fatty liver disease, which is over 30% of the US population, it is a big reflection of digestive permeability and leaky gut and a lot of dysbiotic things that are going on in your digestive system. So you are what you eat, you are what eats. And you are no better than your weakest organ. And your skin is a big reflection of what's going on inside. So keep that in mind, okay? Final tip, simple. Get rid of sugars, get rid of gluten, get rid of dairy, okay? And other common inflammatory foods are foods that when you eat, and they may not be inflammatory forever, but until you're fixed, you don't feel right. You feel tired, you feel bloaty, something doesn't feel right. Get it checked out. Here we do a full digestive panel, details. We look at genetics always. We look at your digestive permeability. We look at stool. We look at food sensitivities, food allergies, how you assimilate these things, and look at nutrient levels. Super, super, super key in treating you in the big picture and in wellness. It's hard to do. I know we're at holiday time. Holiday time means you're eating a lot of carbs, a lot of wines, a lot of sugars, a lot of things that aren't the greatest for you. But at least in the next 3-4 weeks, let's clean up after that and start eating whole, get rid of sugars and gluten and dairy, and start fixing our guts and healing our guts, because that's 70-80% of your immune system. You want to prevent cancer, autoimmunity, big part of it is your diet and gut, okay? Hopefully this is enlightening. Share it with others. You can find and learn more on longevityhealthinstituteinc.com. You can always call our office, make an appointment. Rochester, Madison Heights offices in Michigan here, soon to be in Bloomfield on 15 and Telegraph, and always doing wellness for you and giving you the best in personalized medicine and integrating the best of both Eastern and medicine worlds. So be well. This is Dr. Lewerenz. Have a good week.